COVID-19 transmission after vaccination, what we know so far. One big question people may ask after COVID-19 vaccination is, can we still transmit the disease to others? Although scientists have no definitive answers yet, they have insights that vaccines may lower transmission based on situations. One way to make it happen is vaccines must block the coronavirus from infecting a person. An effective vaccine at preventing COVID-19 can reduce transmission. This is because people who aren't infected can transmit the virus to others. But COVID-19 vaccines are aiming at protection against severe symptoms to prevent hospitalization and untimely death. In an April study by the US CDC, researchers assessed the real-world effectiveness of vaccines by Pfizer, BioNTech, and Moderna. They collected weekly nasal swabs from participants and tested them for SARS-CoV-2 regardless of whether they are symptomatic. The vaccines were found 90% effective at blocking infections in asymptomatic and symptomatic individuals who had 2 doses, while 80% effective in those who received 1 dose. That could be translated as a 90% decrease in infections among fully vaccinated people compared to unvaccinated individuals. The next angle is reducing the virus infectiousness. This refers to the viral concentration in the body when a vaccinated person contracted COVID-19. A March study in Nature Medicine showed that even 1 dose of Pfizer-BioNTech vaccine could lower viral loads after contracting the disease. However, the study was observational and many factors could have affected the results. Another notable angle that can change everything is variants. Brazil, South Africa, and UK variants are rampant in many territories today and have been linked to the surge of COVID-19 cases. Experts believe that these variants are more transmissible than the original SARS-CoV-2 strain. Due to mutations, the variants can easily penetrate host cells and cause infection quicker than the parent virus. To make matters worse, certain mutations are associated with immune evasion. To put it into context, a vaccine should perform exceptionally well against these variants. If a vaccine cannot protect a person from variants, they are more likely to contract the disease, which increases their odds of spreading it to others. This is why vaccine makers are testing the effectiveness of their vaccines against new variants. The Pfizer vaccine appears effective against the South Africa variant, according to Healthline. Moderna, meanwhile, is testing an updated version of its vaccine. Vaccines by Johnson & Johnson and Novavax are not that good in preventing symptomatic infection by the variant. Yet both remain effective in decreasing the risk of severe disease. There are more things experts don't know about. Thus, even vaccinated people must adhere to preventive measures to help stop community transmission.